Are we ready in the back? Are we good? Okay, I think we can go ahead and get started. So welcome again, everyone, to the 46th Annual New Mexico Conference of Aging. My name is Jennifer Vigil. I am a Deputy Director here at Aging and Long-Term Services with Adult Protective Services. I oversee the New MexiCare program and the great team that runs this program. Oh, I just got a little bit. Okay, we're good? Awesome. Okay, so I think with that, we have lots of people. I have a lot of great information that I want to share. I know we have people online, so I just want to welcome everybody virtually. I'm short, so you might not be able to see me. I'm not wearing my heels today, but we're going to get through this presentation. And at the end, I'll certainly open it up for questions. If I am not able to answer your question, I'll certainly get your name and number, and we will follow up accordingly. So with that, let's go ahead and get started. So I'm going to start off by just sharing a little bit of background information around how New MexiCare came. So we are providing this program to better support residents of New Mexico. We want to ensure that there's support for caregivers and also participants and residents all over New Mexico. We also want to ensure that the services being served to people are living in rural communities, and also so that we're able to provide technical and assistance and support for service and eligibility. So really the highlight of this is that we want to best meet the needs of New Mexicans in all areas of New Mexico. Now, the purpose of this program, as you know, there are a lot of unpaid caregivers in communities. They are serving family, friends, neighbors, people that live next door, people that they may not even know. And so really this program is really designed to provide financial assistance for up to $1,400 per month to eligible participants and caregivers who are assisting family and friends. So again, lots of people in our communities being underserved. We want to ensure that they have resources and services available to them. And in turn, it also allows older adults to thrive in their homes and in communities, reducing the number of nursing home placements as well as emergency department visits. So let's go ahead and talk about some overview and eligibility requirements. So to be a participant, the applicant or the participant in the program must be 60 age or above. They must live in a covered area. Now, currently we are in all counties with the exception of Bernalillo or Doña Ana. Now, keep in mind, the goal is to be statewide. We are building the infrastructure for this program. We want to ensure that it is a successful program. So I would encourage folks to apply regardless of the county that is being served at this time. In addition to that, we want to ensure that the participant has cognitive or physical limitations requiring assistance. Again, this is a family caregiver program, and so we want to ensure that we are serving those in need. Also, we want to ensure that the participant is not already receiving services in another program through another government entity. So there is the home and community-based waiver that people may be familiar with. This program is really designed to increase the income limits and so that we can serve those who are not eligible for Medicaid. Keep in mind, there are other programs. Veteran Affairs also, offers a similar model, but we will work with you. So just know that once that application is approved, we provide technical assistance and support from start to finish to ensure that all your questions are answered. And then I've also noted the gross income level, which is adjusted annually, and also the resource level. Let's talk a little bit about some services and goods. So I have a handout with me that I'll just share real quick. So I will also share this online. It'll be posted on our website, but essentially our program offers personal care, also referred to as home care services. And this really allows the caregiver to assist the participant with any daily tasks that they would normally do. So again, light duty house cleaning, simple household repairs, meal planning, preparation, sanitation, and then any kind of general household management. We will get to transportation in just a minute. Some other goods and services so personal care and home care are part of the program. And then participants can also decide what goods they are interested in. So they may want adult daycare, they may want respite, they may want transportation, their caregiver, maybe it's their granddaughter driving them to a monthly appointment. They would be able to get reimbursed for that. And then we also have home health and safety monitoring. This is along the lines of, purchasing or installation of equipment, something like maybe grab bars, maybe, there needs to be a larger doorway for a wheelchair, those environmental modifications, if you will, that may be needed. And then we also pay for prescription copays or deductibles. As you know, a lot of folks may need assistance with the deductible. Some of these deductibles can be higher and they may need money to cover that. So this is just another good that is available to them to choose as part of the program. Now, you all have a handout which outlines a little bit more details regarding these services. So should you have any questions, we can get to those at the end. So let's talk about some steps to accessing New MexiCare. So at a very high level, it's a 5-step process, okay? We offer the application online or via email. Online or via phone. So you don't have to have a computer or internet access. You can always call the 1-866 number, select option 4, and our staff will help you fill out that application. Now, keep in mind, that application is going to take a little while. There's some information that we have to obtain in order to go through this process. So I would say just be mindful of that while making that phone call. And then we gather required documents. 3 months of financial statements, checking and savings. This is just to confirm eligibility. We also ask for identification and copy of Social Security card. That is in accordance with the background check requirements for the caregiver. And then if your granddaughter or grandson or, the caregiver is going to be transporting the participant, we ask that they provide a copy of a valid driver's license, vehicle registration, and insurance as part of the transportation service. Now, step 3 is the home visit. So during this time, we have community engagement specialists who are located statewide. This really allows us to be able to go into the home and conduct a functional assessment to ensure that the participant meets the requirements. It also allows us to spend time with you and others in the home so that we can help with filling out paperwork, really just time to talk through the goods and services, ensure that you get the services that you need. And then the 4th step is completing the criminal background check. Now, this is legislation that was passed early this year, and so it's important that we are in accordance with this, and so caregivers will be required to go through background check. And then the last step is 6 online training. So we have Care Academy that is through our online platform, which really highlights how to administer medication, things like emergency preparedness, really just giving more tools and resources to the caregivers. The New MexiCare payment process. So this process, we've actually partnered with Eris Solutions, and they are our financial management service vendor. They really are the role of the fiscal agent to assist participants and caregivers with payroll process. Now, once you've been approved and you've gone through the 5-step process that we just talked about, you are then going to be submitting essentially timesheets. Participants and caregivers are required to submit timesheets and approve timesheets so that they can receive bi-weekly payroll. Now, again, Eris is here to help. We're here to help. We're here to help through the entire process. So I just want to highlight that. And depending on the paperwork that is complete by the participant and caregiver, the caregiver will receive payments via direct deposit or paper check, all depending on how the paperwork is complete. And the service period is for 1 calendar year. So again, technical assistance and support. Everybody can get their cameras out. For more information regarding New MexiCare, you can always call the 1-866 number. Our program coordinator is amazing. Our community engagement specialists also answer these phone calls. They will assist you with anything that might come up. And then there's also an email box. Feel free to email that mailbox as well. If you have any questions, if it's just quick, we'll get back to you in that way. And then of course, to submit an application, we have the 1-866 number, and then we also have the online version. That concludes my presentation, and I'm sure that there's a ton of questions, or maybe not, but I do want to open it up specifically for Q&A online. I just want to mention, please, I'll actually go back to the other slide. If you would not mind, please email your questions directly to the email box for all the online and for our in here as well. Go ahead. Is there a cap? I just want to make sure I understand. Is there a cap for participants this year? Are you referring to the number of individuals on the program? Not right now, no. Right here. So the question is whether or not the client needs to hire somebody, and correct me if I'm wrong, for the installation of grab bars, if they would need to go through the application process. The professional person. So essentially like a contractor. The contractor would not need to go through this particular application process. We have our fiscal agent, Eris Solutions, in which they would require them to fill out a form in order to be paid. I think we have right here in the back first. Can they work together simultaneously? Because they also have the disconnect. Can they utilize both this particular and that? So the question is whether or not a client can be on VA services as well as New MexiCare. Is that correct? That would be a duplication of services. I think we'd have to serve it on a case-by-case basis. I would say it all depends on the VA program. I will say New MexiCare has a veterans program as well that I'm not speaking about today. So I think it's just a matter of partnership with our veteran affairs to ensure that there's no duplication. Happy to talk further. Lady, yes. Unfortunately, ma'am, no, he would not. Thank you. Go ahead. Yes. Mm-hmm. But I'm wondering, would, you know, if she gets qualified for the program, could it be to pay someone help me out? You know, like to come in like maybe 2 times a week if okay. Yes. So the question is, this nice lady is taking care of her mom, and she wants to know if this would be an option for their family. And the answer is yes. That is exactly what this program is designed to do. We want people to be able to have support for the services that they are providing. Sure. Yes. So the question is, husband is veteran, wife is not. That is correct. What we are doing is we are really assessing um, the best services. So, we may even give you an option for your father to be part of our veterans program or New MexiCare, just to ensure that there's that service, and that both parents are getting the supports they need. Yes, both should apply. Let the process see it through. We will determine if they are not eligible, and we will communicate that with the people that are applying. So my advice is it doesn't hurt to get an application in. And if we can't provide the supports to you, we always want to be able to provide another resource. So if we can't help, we want to point you in another direction if we can. Ma'am? So the question is, after an application is submitted, how long does it take? I don't have a specific time frame for that answer. What I can say is I've seen people get on the program within a month. So keep in mind there is a background check and training. So as soon as we can get you through the process, we certainly will, but I've seen people get services within a month. Yes. Mhm. So what I would say is that this particular program is meant to be statewide. We are taking applications and communicating with those that are in these counties. I'm sure I'm not familiar with other programs specific. I can tell you that the veterans program is an option. So if anybody knows a veteran, that's certainly somebody that we can tie you to that program. If you know somebody that needs care, I would certainly call the number and we can provide additional resources or make sure that we get you an answer. Sure. Lady in the back. Mhm. So yes, the question is, she has somebody close to her that is in need of services, 90 years old. When you're filling out the application, there is an opportunity for a requester, which may be the person filling out the application on behalf of mom, dad, grandma, grandpa. And then we also ask for the applicant's information and the caregiver's information. Sometimes the requester and the caregiver are the same people, and we recognize that. So there is an opportunity for it to be filled out on behalf of someone. And then what I would say is if there is, any documentation or anything that, our agency would need to know, you could always provide a copy of that. That's okay. Yes. Sir?
The 6 hour classes that are required, is that the same program as the caregiver respite training with your partnering with ARCH?
ARCH. So the question is whether or not it's the same training as ARCH. It's So it's actually separate. So the Caregiver Coalition also offers an opportunity for caregiver training. And I think it's to be part of their registry specific to respite. I highly encourage it. I know they're looking for providers and individuals, but in the long term, we would be partnering with the Caregiver Coalition and looking at how to streamline things. Sure.
Families taken care of, family members with dementia.
Yes, that's correct. Family members taking care of individuals with dementia do qualify for this program. Thank you. Mhm. Correct. So the idea is that the service plan, people who are approved for our program will receive a service plan outlining those details. It'll say exactly how many personal care or home care hours are approved for the program. And then it will also state what goods and services were selected during the home visit. There may be multiple. A lot of people want transportation. They want health and home, the safety monitoring, and then they also want prescription deductibles. So we work with them individually to determine what the priority is. And then, I just highlight that this is support, right? We may not be able to cover all of the costs, but we are certainly trying to provide the best support that we can. Any other questions? It's cooling down in here, I will say. I think the air's on. I think in the back first. So it's through Care Academy. You will receive, if you go through the process and you're approved for background check, you'll receive a username and a password. It's 6 1-hour classes. Off the top of my head, I think there's one for medication administering. There's one for time management, emergency preparedness, and a couple others. So they're 1-hour classes. They're at your leisure. So there's no specific time frame, but again, just encouraging folks to get through the process so those services can be rendered. Is there another question in the back? Okay. So there's onboarding paperwork with Eris Solutions, who is our fiscal agent. And that onboarding paperwork really helps with the payroll. So they are not becoming their own entity. I think they're obtaining, I don't even know what I think there's an ID that goes through this process in order for them to be able to submit, timesheets and be paid and pay workers' comp and all of those things. So I would say that if there are specific questions, if you're already in the program and have questions, let's talk after this. And let's make sure that we're answering those questions. Thank you. Right. So what I will say is that this is a brand new program. Our service plan is for 1 calendar year. That does not mean that the program is going to end in 1 year. We're just looking at ways of getting all the good information out to folks appropriately. So what I would say is that, this is a governor's initiative. This is truly dear to her heart and something that, is dear to ours. So we want to ensure that services are rendered longer than 1 year. Oh, perfect. Go ahead, in the back. So the question is about how much time will be spent. I believe, is it as a caregiver, sir? Is that the question? Okay. The caregiver hours are dependent on the functional assessment and the service plan. And so it could be anywhere between 17 hours a week to, I think, 68, or I'm sorry, 17 hours a week. I don't want to misspeak, but it's all dependent on the service plan. That's how the personal care service hours are determined. And there is an opportunity for more than one caregiver if need be. We do provide an option for a backup caregiver. So, they would have to go through the background check process and the training as well, but more than one person could be the caregiver should one caregiver work full time. Sure.
Caregiver already find like a friend or maybe a personal paper. You have to come with them already, or you get in the program and then find one out.
So we're currently, the question is whether or not you need a caregiver to be part of the program. As it stands right now, we are working with participants to find caregivers. We also know people in communities that are willing, that do this for a living and are willing to do it. So what we're really trying to do is tie the resources together and, share information and knowledge amongst, especially for those ones that don't have somebody. So what I would say is certainly apply. We do have, a category for these folks that are, we know are going to need caregivers. And what we're trying to do is also provide that support to find them a caregiver. So thank you. Question in the back? Sure. So the question is about an individual, her uncle in the home that is blind and also needs services. So yes, the answer to your question is the caregiver would go through a background check. Yes, there is. So the question is the participant, is there a eligibility requirement to be part of the program? That is correct. So they have to need help with 2 ADLs and then the income requirements. So all of this is on newmexicare.org. All of this information is online. You will be able to find it. Again, if there's something on our website that you are not able to find, by all means, do not hesitate to either call our 1-866 number or feel free to send an email. Any other? No. So the question is, if I'm in Bernalillo County or Dona Ana, do I apply? The answer is yes. We do want you to apply. We will be expanding into those areas. As you know, they are our highest population. So we want to ensure that we have, the team in place when we do roll out. So I would definitely suggest applying. We'll go through the, initial eligibility requirements just to ensure that they do meet those eligibility requirements. But yes, do not hold off. I encourage everyone to apply. I think there's one other question in the back. So it's actually split. The way we look at it is the primary and the secondary caregiver. Go ahead. No, and I just want to make sure I understand because I know there's a lot of waivers. So what I will say is that we don't want to duplicate programs through different government entities. I would encourage everyone to just, apply. We will see that process through to ensure that if for whatever reason they might be on the DD waiver, the MVIA waiver, we are able to see that through together. But I would say, this program is definitely for people that do not have that type of service right now. Question in the back? Yes, it does. The question is whether or not transportation is a service, and yes, it is a service. There is no mileage requirements. It's based on hourly. So in the service plan, essentially, that is being developed in the home with the community engagement specialists, going through the different goods and services, we would talk about, medical appointments, things that need to happen and how we can support those. So we might say, okay, well, grandpa has an appointment once a month and it's going to take, 2 hours to get to and from. And so those are the things that are discussed in the home with the community engagement specialist so that the service plan can be set up accordingly. Any other questions? We got, okay. So the question is whether or not a client can apply if they're receiving home hospice. What is the other? Home nursing care. The answer is yes. This is specific to caregiving services. So if they are receiving physical, PT, OT, anything like that in the home, they are still eligible. Question in the back? So the question is whether or not the income guidelines are for the caregiver or the participant. And I would say the participant, not the caregiver. So the funding and the financial assistance is funded through us as ERIS as the payroll entity. So payroll is processed biweekly via timesheets, either paper or electronic, but essentially it's funded through the state. And we could talk offline if there's additional questions you might have specific to ERIS. So I think, and I just want to make sure I understand, the question is whether or not the participant would pay for the services to the caregiver. And the answer would be no. This program is for participants who apply, who are eligible. We use the income guidelines as a guide for us to really target those populations who are not eligible for Medicaid, but essentially we partner with a fiscal agent to pay for those services.
Is it income only, or is it they own their home, is that also considered income?
So that's part of I'll take that back. I know there is a resource level, but I don't know for sure. I don't think so. Next.
The home is considered.
Right. Because I think that's getting into assets and a whole other, and so we're definitely not asking for any kind of documentation related to any of that. We're really just looking at income. Question? No, correct. We also have clients that are not getting Social Security. We have clients that may have been eligible for Medicaid at one point, but don't have services now. And so I think the idea is that we are here to help. We are here to provide support. And, it's going to be on a case-by-case basis. And some Some are going to be very easy, but others, you know, we're here to work through those. One more question? I don't want to answer that. I think that's getting a little bit too much into the weeds. Certainly don't want to give or misrepresent what our program does. I would encourage everyone to just apply and, you know, again, we will look at, you know, these nuances on a case by case basis. I appreciate everyone's time. Thank you for staying through the heat and the cold. I know I think there's going to be lunch later. We also have a table with a lot of goodies. I'm sure some of you have already met Desiree. She's one of our community engagement specialists, but thank you for joining the new MexiCare session. Have a great day, everyone, and have fun.